We have something fun for the channel today. I have a good friend, Betsy, who has worked in healthcare for all of her career. I've often talked with her on the phone about health issues, getting advice. And one thing I found is that she has a lot of knowledge about how to talk to your healthcare providers. Important for many of us as we get older. If you're like me, you may be nervous about asking your doctor questions, anything that may sound stupid or whatever. But let me introduce Betsy, let her tell you a little bit about her experience.
Hi, my name's Betsy, and I was an RN for many years and an EMT about 1981. And as we say, once a nurse, always a nurse. And so, Alicia, thank you for having me today. It's greatly appreciated, and I love to share my knowledge as best I can. I worked at skilled nursing was my last job, so that's that and acute care, hospital, med surge. So I'm just a grunt nurse, but I enjoy sharing my knowledge
Right.
regarding how to talk to doctors and how to work the system.
Oh, that's awesome. I know personally, I've always had a hard time just really being upfront with doctors, with telling them what I need, with explaining other problems. I've gotten a little bit better about it over time, but during the COVID period, I had a neurologist that it was an Asian guy, nice guy, but for the first two visits, all I saw was this. He had a web camera on the top of his screen. He was looking down at his screen. I had never even seen his face. And on the third visit, I finally told him, "Could you please look up and just let me see who you are?" And he did, fortunately. But doctors aren't always the best people person, are they, Betsy?
No, no, they are not. Some are, it just like they're like any other person. We all have to learn not to be intimidated. Now, not everybody is, but I can remember way back in the dark ages before I was a healthcare person that I was scared by doctors and I was intimidated by their demeanor and intellect, I suppose. So number one, no, they are not gods. They are just human beings. And you can say anything however you want in your own individual fashion to them.
Okay. Do you have any recommendations of what to do in preparation for an appointment that you have with your doctor?
Yeah, always make lists. I know I am getting more forgetful exponentially in my older years. So I make lists. I also, if possible, recommend using healthcare systems that are linked. So, for example, I go to a university system. That way, all my information is in their computer. And I have one app because, unlike you, I am not as adept and I may be your healthcare helper. You are my technology helper because I
Mhm.
am. So having one app with all my information, all my medications, all my health history. I know that some people don't live in areas that have this capability, but I highly recommend it for seniors because it's best to have all doctors on one page. It's called continuity of care. My cardiologist wants me to be on med A and my neurologist wants me to be on med B. Well, they'll prescribe medications prescribed by different providers. And there's even an app called MyChart. And I recommend going into that app and seeing if your local providers are in it because it's a wonderful app and a link to many facilities throughout the nation. I've used it at two different healthcare centers that we've used, University of Utah and University of Colorado. Just something for people to know too, in our post-COVID world, people need to be aware. A lot of doctors, nurses, a lot of healthcare people have retired and or quit, changed jobs. COVID really was hard on many, many people in healthcare. One of the reasons we moved to Colorado was because the University of Utah lost 13 cardiologists to COVID. Well, I was told by one of the cardiologists, just
Right.
be aware specialties like neurology can be a long wait. They do the best they can. If you have a cancer or something that requires a more rapid response, they're good about trying to get people in, I've noticed. But sometimes some departments haven't bounced back. Neurology is one of those, especially for those with Parkinson's or my husband with Lewy body. We had a hard time getting it, took over a year to get his diagnosis because we had to leave Utah because
Right.
they ran out of neurologists too, on cardiologists too. I ran out of everything. So, welcome to Colorado. It's an interesting time in our lives because depending on where you're at in your senior years, you're getting hit with these new diagnoses that can be a little jarring, but the system, you can work it. You just make a list, find a group you're comfortable with, make sure communication is open. One thing I notice people don't realize with Medicare is things like oxygen and other things called durable medical equipment, like your walkers and wheelchairs and all that other stuff. Medicare doesn't
Mhm.
necessarily cover a lot of the conveniences or a lot of equipment. So be aware, Medicare will either say,
Mhm.
no, we don't cover that, or, and you might have to pay privately. But like with oxygen, they're not good about giving you those little packs you see on TV that make you easy to go play golf or walk around, or no, Medicare does not cover they'll cover a portable tank, which is not portable. Yeah, it has wheels, but it's also 3 feet tall and probably weighs 20 pounds or some crap. Oh crap. So
Oh, crap.
just be oh crap. I have to go somewhere. I have to load the oxygen. Oh crap. I need a crane. Medicare doesn't provide a crane for the oxygen tank and all the crap. I need to go anywhere now.
How do you even handle flying commercially with, if you can't get a small oxygen bottle?
I haven't done that yet. I've been I have to find out, but apparently I need to advise the airlines that I'm coming to fly with them because the bottle is explosive. Oxygen tanks, if depressurized, become missiles. And
Oh, right.
I was taught, never point the missile
Yeah.
toward you. Always make sure that the valve is pointing toward you, so that if the valve comes off, it shoots out the back of the ambulance and not into the front seat where you're driving, and you and your patient die. Um, so a, I do have a portable device that is not a pressurized tank, and I apparently have to notify the airlines that and get their permission, or I don't know how this works exactly. Also, with my diagnosis, I can't go over 8,000 feet. So
Right.
anyhow, 8,000 feet. So living in Colorado is like, well, I want to go west, but golly
Well,
gee whiz.
yeah, now that I'm living at sea level, I really feel it. This past summer, we went up into the mountains at 8,000 feet, we're staying in a cabin, and I was getting altitude sickness. I didn't realize it initially, but I was getting terrible headaches, feeling nauseous. And I looked at my blood oxygen, which my Apple Watch will check, and it said that it was down to like 88%, which, like, holy crap. That's,
That's
yeah, I,
if it's so. Just a shout out to anybody out there with an Apple Watch, and I didn't know because I'm technologically impaired. If your Apple Watch says 88%, that is not conducive with. It's conducive. Let's just say, go down, move, get down
yeah,
to the station quickly, please. We all want our oxygen levels to be 90% or above. It's not going to kill, but
right.
it's really bad. Okay, so yes, that, and as we get older, we become more sensitive to things. I start getting altitude ickies at 5,000 feet, and now I've lived over 5,000 feet for 10 years, so I'm in a permanent state of oh crap. And this is another reason for the oxygen is
Yeah, I was doing better. I mean, I used to live in Utah also and lived up in the mountains, and it was completely different. But, I think a lot of it is getting older. I don't
yeah,
know.
be aware.
It was at my brother's cabin, and I went and spent the weekend up there. It's like,
Ooh,
I don't know if I can do that anymore.
right, right, and be you might not be able to, and or at least talk to your doctor, make arrangements to have some supplemental oxygen if they see that's necessary. Oxygen is a medication, so I don't want to tell people to run out and get oxygen. Please don't do that. Please talk to your physicians about anything that I have discussed, and make sure it's okay. Oxygen's medication, and it can kill you if you used inappropriately, incorrectly.
Oh, that's
Yeah,
important.
yeah, it
Yeah.
can shut off somebody's need to breathe because it is controlled. The need to breathe is controlled on a feedback loop with it senses oxygen and carbon dioxide levels in our blood, and it tells our brain to breathe. And if we take too much oxygen, the brain goes, "We have plenty of oxygen." Where yes, oxygen can be dangerous. Not only does it explode, it can cause you to code. No, code blue.
Right.
Yes, but she's on 15. That's exactly why I
Good
coded.
to know. One thing that I've always struggled with doctors, I hate going into an appointment, and often it'll be the nurse or assistant that's checking me in that'll say, "Well, how's your pain level today on a level of 1 to 10?" It's like, I don't know. I mean, how do you compare? How do you tell healthcare workers and doctors about your pains anyway? And you may have ongoing pains like neuropathy, or when you're talking to them, I'm not even sure if I should bring up some things. It's like some of it may be embarrassing to talk about my bowel movement, about my, whatever.
Hey, I love bowel movements. That being having a surge nurse, those were really important for those post-op patients. So we love poop. We live poop. We wanted to see poop every day. And it is not embarrassing, it is fun. And believe me when I say some of us thrive on feces. Health, there are issues that can be very embarrassing. And I found myself, I've shed so many of my foibles. I don't know how to describe it. I'm pretty much out there now. I will lay it all out. So what I found is that I listen to my body and I will tell the doctor any new ache, pain, whatever. So that's where the list of questions, symptoms is really important. As especially as we're aging, because this is a time we need to listen to our bodies. The pain scale is based on your perception. So everybody's going to be different. For example, let's take, like my granddaughter is very young, but, she's a teenager. Her pain scale is going to be way different than mine. She made her 10, so that the 10 on a pain scale is the worst pain you've ever felt in your life. So I had an experience in the hospital with many of my orthopedic surgeries that is my 10. It was a back surgery, and that was a 10. And I use that as my reference point. Now, for her, her 10 may be a broken collarbone. There is a world of difference between a broken collarbone and like knee replacement. That's another, could be a 10, let's say. So our perceptions are different. And so we're basing it all on our own perception. That's all we got. So your 10 is going to be in your mind, whatever your worst pain you've ever felt in your life is, and then reference it accordingly. So for the
Right.
most part, and I deal with chronic pain, is, I'm good. Like right now, if they asked me, and I was at that doctor, it's every week, it's a different doctor. And this week was pain doctor. They ask me every time. And I'm, it's like two. I'm at a two. That's good.
Okay.
I can live with two. So, you know that there's no right or wrong answer. Again, lists are important. That list can be shared with multiple doctors because it may not be a cardiac problem. It may be a pulmonary problem, or it may be an endocrine problem. Making lists and
Mhm.
having MyChart or portal, as much as I am not one to promote
Right.
technology, this is a case where it is really important because communication is number one in healthcare. You want all your doctors to know everything going on so that you don't end up in the hospital with some medication precipitated illness
Right.
because doc 1 and 2 didn't communicate. And this has been an ongoing issue in healthcare for as long as I can remember, the lack of communication between healthcare providers. It's nothing against doctors, believe me. It's just they're very busy
Absolutely.
men and women and very hard to keep track of everything. As much as we like to think, we got to remember they aren't God. They're like you and me. And I still need a grocery list, even if I forget it. They are the same. They need lists. The best way we can help them is to help ourselves. We need to take responsibility. We need to advocate. I believe in speaking out to your doctors. I believe in advocating. I believe in lists. Any communication you can do is going to make their life and your life that much better.
Well, how do you communicate with them if you have a difference of opinion? If you don't agree with some diagnosis they made?
That's a hard one. I smile nicely and I do listen. I do my best because they are the professional. And remember, do not,
I Googled it.
just don't even say the G word to a doctor or a nurse or anybody in the healthcare profession. I finding another doctor, just go to another doctor, get a second opinion, get a third opinion, get 15 opinions. And then just you get to decide for yourself what's best for you. This is the biggest thing that seniors have issues. The biggest thing in a senior's life, one of the biggest, is loss of control over aspects of our life. And we thrive to maintain control of many things in our life, and we have to give up. Some of us have to give up driving.
Yeah.
Some of us have to, we have to give up foods we like. We're losing control. And it sucks. And I scream and yell. Don't take that away from me too. No, you can't have my sugar. It's the only flippin' thing I got left. You aren't getting that. So it's like control obviously becomes a bit of an issue. I can't stress enough. Okay, so in that particular case, okay, even though doctors are human, if you confront them regarding their specialty, they can do bad things. They can chart that you're non-compliant. They can chart that you're psychologically unbalanced. And that then gets put in your permanent records, like you're in prison or something. I don't know. And then other doctors can read it. So we want to not piss the doctors off. For me, it was a hard lesson I learned from experience. And as a nurse, I pissed doctors off on a regular basis, waking them up because I worked night shift, and I found some joy with some of them.
Right.
Most doctors are the sweetest people in the world, and they are there to help. And remember that they're there to help. But there are a handful in any profession in the world of assholes. We've all had them. And the best thing is for us to find somebody that we work better with, and then leaving reviews. I believe in reviews for really good and really bad,
Yeah,
and
that's good to know.
that's a way to get it off your. I get it out.
In what situations would you recommend getting a second opinion, and how do you go about telling your doctor you want a second opinion?
Um, I think second opinions are good for anything of like a major surgery or cancer. If you're going to have treatment for a long time, it doesn't hurt to get a second opinion. I don't do it that much because usually I've found that the doctors are. And I also I have a background where I can use that word I said not
Right.
to use. I but I can go to I go to the NIH, and I go to sites that are more medically based. And if you know the big words and you understand it, you have some background, it's your body. You have a right to look anything up you want. Just don't say you do it. But I would get second opinions if you have any concern. If it's something that
Hmm.
certain cancers, if that's a hard one for me to say because I have a medical background and historically worked with doctors I know and trust. But I would think cancer things, big ticket items. Sometimes cardiology, it requires quick movement more, and you don't want to wait for that second opinion. And so that's another thing to weigh. That's a hard question. That's a good question. It's it's not easy, and being a patient is not easy. When you're in the hospital, you lose all control. You have control over nothing, and except maybe the TV. I mean, you can't sometimes even control your bowels and bladder. So, um,
Right.
there is nothing about healthcare that's easy or simple. There's nothing that should be overlooked. Communication is so important to make your journey through the last quarter of your life that much better. There are so many new treatments, so many new
I believe it.
doctors. I mean, there didn't used to be doctors that specialized in pulmonary hypertension. I mean, that's a part of the body that's like so small. I think between my husband and I, we probably have 15 to 20 doctors because just for pulmonary hypertension, okay, pulmonary lung, but it's my heart. So I've got cardiology, I got pulmonary heart. So that's, and then I've got rehab, and I've got it just keeps going. I mean, last week I was there every day for something. And this is what our lives become and it's a juggling act. It truly is. So it's communication. The other thing is every once in a while, it's okay to take a break, say, whoa, I have done enough doctoring. I am doctored
Right.
out. I need a respite. Give me a break. I need, I need, I need a vacation from this. You don't have to go anywhere, but you tell your doc, say, I am taking a break, and do that. Do things. If you get frustrated, take time, take back control.
That makes a lot of sense.
Communicate and take control. We got to remember it isn't just quantity of time, but it's quality of time. And I have to judge my quality of time and quality of life. And I'm going to keep my sugar. You've taken away everything else, just about. I'm not diabetic, and so my A1Cs are good. And so there you have it. Nobody prepared us for these golden years. My ass.
Oh my gosh. How do you handle, let's say you have an unusual pain at home. You don't have an appointment scheduled, you don't have anything coming up. At what point do you consider going into an emergency room?
If you have something that's concerning enough for you to think emergency room, my rule of thumb is go. It never hurts. Just go. Don't ever question it. Never question yourself. If you're that concerned, you've got insurance or whatever, you go, because you never know,
It's
right?
yeah,
And heart attacks, oh, especially in women, can be kind of insidious. Part of knowing about your body and knowing, have your annual physicals and talk to your doctors. Ask any question. Why is this high? Why is this low? Why am I taking this med? I don't want to go into signs and symptoms of things, only because I could get myself in trouble with that. That's something. I am not a doctor. I can give nursing diagnoses, which the one that we all have is anxiety related to personal thing
sure.
is, if I think I need to go, then just go. Do not forget to follow up. Maintain that line of communication so that anything that comes up can be looked at, and so that they have a record. Just, I can't stress enough keeping those books open to everyone, because it's so much easier, especially if they say, well, we want to do a CT or we want to do an MRI, but you can go, wait, I think I had that done. I was in some machine in my ER visit, or I with Doctor X. Can we look in my chart? Oh, my chart, that nice app. They have it as, it's called
Right,
something. They can then go in and look and say, oh, yes, not only are you going to save the government money by not having to redo the test, you're going to save your own self having to go in and possibly get stuck because it requires contrast. You're going to save
right.
your time, and you're going to save, not get zapped by x-rays or have to sit in a boom, 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 boom MRI.
Oh, it's a horrible sound.
Yeah.
Yeah,
I'm really trying to hear my music, but I can't hear it over the boom, 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 boom.
yeah,
You know, get
yeah. They always ask, "What music would you like us to play?" It's like, I don't care. I'm not going to hear any of
right.
it.
Say what? Remember that your records will have all sorts of, labs and stuff that, if you say, did we already do that? Can we look and see? Man, you can save yourself time, and you can save, sorry, Alicia, but this one nice thing about computers is keeping all of our medical records in one nice container. I want all the eggs in one basket.
Yeah, exactly. Do you have any recommendations for how people can kind of monitor their own health at home?
I think if you have a diagnosis of high blood pressure, you're having a hard time, it doesn't hurt to have one of those little portable blood pressure machines. I truly believe in a little inexpensive device called a pulse oximeter. It's those things they put on your fingers and press a button. Are they accurate? Yeah, close and good enough. It's going to give you at least a ballpark. So right now, yeah.
Right,
So you give it a minute, let it capture your pulse. You don't just throw it on, go, oh, good, off. No, you give it
right. For
some
your
time.
oxygen
And
levels.
so right now, when I first put it on, it said 97 and a pulse of 90 something. So I'm running about 95 and 73, and that's perfectly acceptable to me. I like that. So these little things are handy. There's something I saw on TV that I do not recommend. Some kind of device you put on your phone, and it says, "Oh yes, for only $99, I can
Yeah.
tell you about
Oh,
brain
that thing where
tumor."
you with the hold your finger
Yeah,
down on the
yeah.
pads or
It's like, for
something.
only $99, we can tell you if you have these arrhythmias, bradycardia or tachycardia. It's like, no, do not, that device with the two fingers. Bradycardia is my pulse is less than 60 is the definition. Tachycardia, the definition is my pulse is greater than 100. I
Right.
can do that with this and a sweeping second hand, or this. One's free and one's, like 19, $20. If your doctor says get it, then do what the doctor says.
Right. And I think it's the same with like the Apple Watch. I've got an Apple Watch 9, but frankly, I wouldn't trust that anyway. Any of these simple devices are not the final word on your health, correct?
Correct. That is absolutely right. An Apple Watch cannot do an appropriate EKG, because a true EKG, you have to have stickers in 3 different spots: right arm, left leg, minimum. 12 lead, you've got
Right.
exactly what it says, 12 leads. It's looking at taking readings so that it can look at different parts of the heart to see if part of it is not working right. So nothing replaces true diagnostic stuff that's in the hospital. As far as at home, having just simple bandages, I always recommend having Benadryl, because it is a true antihistamine. I've only ever seen one person in my entire life who was allergic to it. But if you're allergic to Benadryl, don't take it. But Benadryl is a true antihistamine, and is to always talk to your doctor. I have it on hand for my family because of allergies, and it has come in handy in emergent
Yeah.
situations.
Here in Arizona, we pretty much have to because we have little bugs called scorpions. And I've heard that,
There's
if you get stung by a scorpion, the best thing is just take Benadryl and go to bed and try to
right.
get past it. Yeah, unless you have a serious reaction, of course, then you have to go to the emergency room. But
Right. And usually things that are going to be, always any break of the skin will, you're always susceptible to infection. It's kind of like people say, oh, you don't die from measles. No, you don't die from measles. You die from the secondary infection, the pneumonia. So caring for oneself at home is how comfortable are you with blood pressures, pulse, some of the devices. The main thing I cannot stress enough is don't be a machine watcher. Don't be the person that's going, my pulse ox is 90. Oh my God, what do I do? I need to bring it up. Oh, it's 92 now. Oh, that's better. Oh, it's 88. What should I do? I can't stress enough that it's how you feel. Go by your symptoms. If you're feeling poorly and the numbers show that okay, I feel really dizzy. Oh, yeah, my blood pressure is 80 over 40. Maybe I should lie down and do what my doctor says if my blood pressure is low. Whatever's appropriate for me, or oh, I've got this screaming headache. Oh, my blood pressure's, like 190 over 120. You may want to call your doctor at that point and say, I've got this screaming headache and my blood pressure's 190 over 20. So important to consider symptoms when doing your assessment at home and determining whether you need to see a doctor or not. So whatever you are comfortable with, there are devices all over. You can, if you want to know if you're
right,
bradycardic or tachycardic, you can spend the $100 for that little device that's going to show you the same thing that the pulse ox does. I can't believe that they are actually selling that for $100. It's just, that's kind of like rip off Boomers Inc. So it is. Yeah, there's a lot of scary out there that healthcare is a big
right.
business. It is a very big business, and there are reputable people and unreputable. So, for the most part, it's reputable.
Well, this is all fantastic information. Is there anything else that you would suggest for people that in dealing with their own healthcare and their doctors?
If you or your listeners ever, come up with a list of questions, I mean, I'd be happy to come back and just do questions.
Well, I think this could lead to many discussions after. We'll have to see what questions people have. So, any of you watching, leave your comment below. Make sure you subscribe so you see any follow up. I love this. I thank you, Betsy, for being on here and for talking to us.
Well, Alicia, thank you. Thank you very much, Alicia. What you're doing is a wonderful service for all seniors. You provide information for us to make our lives that much better and take back some of the control that we are losing. We need to maintain control of our lives as much as we can, for as long as we can. So thank you.